Okay. As you just heard, we're recording tonight's program for posting on our website. Welcome to this week's Becky Schmooze. Unless you are tonight's speaker, please mute your microphone. Dan Weinberger shared his insights with us back in July 2020. We're sorry that we need to continue to discuss COVID-19, but we're delighted that Dan has agreed to speak again. He's an associate professor of epidemiology with a focus on microbial diseases at the Yale School of Public Health. Perhaps you've seen him quoted in the press on topics such as COVID booster shots or COVID death rates. His topic tonight is COVID-19, where are we now? After his presentation, we'll invite people to unmute to ask their questions. Let me go to speaker view. Thanks, Dan, for joining us. Go ahead.
Yeah, thanks for the invitation. It's nice to see some familiar faces. I have to admit, it's been quite a while since I've been back to Shabbat at Becky. We were, shortly after I gave my last Becky Schmooze in July 2020 or so, the family moved over to the Netherlands for a while, and we're still getting back into our routine here in Westville, but hopefully with the weather warming up now, we'll be back. See you all in person soon again. Okay, so let's get my slides up here. So I just prepared a few slides to get the conversation started. I want to tell you a little bit about some of the work that we've been doing. Oh, I don't think my screen is sharing, is it? Let's see. Okay, yeah, I want to tell you a little bit about some of the work we've been doing on COVID, and I thought this crowd might be interested, especially in some of the work we've been doing with some collaborators in Israel over the last year around COVID vaccines. So just good to start the talk by acknowledging the people who funded the work, which is the NIH and National Institute of Allergy and Infectious Diseases, and just I always disclose that I work with Pfizer and Merck on various projects, but none of that is related to what I'm going to be talking about tonight. So first of all, why are we working with folks in Israel on this, and why is this a good place to understand what's going on with COVID and COVID vaccines? So Israel is extremely aggressive in rolling out vaccines very early. I think is the first country to really introduce the mRNA vaccines at a large scale. And they were really well positioned to sort of monitor the effects of the vaccine there. So they have excellent, several excellent large HMOs that cover a good part of the population. And importantly, these HMOs have really amazing sort of health information technology systems that allow us to sort of get data that are very detailed and ask questions about vaccines and risk factors for COVID. It's also a really diverse population, and some of the work we've been doing is down in southern Israel, in Beersheba, where there's a single pediatric emergency room that is the only emergency room in the region, and it caters to both the Jewish and Bedouin populations, which are demographically very different populations, and they're living in the same area but are generally pretty segregated, and the family sizes are very different, and the contact structures and everything. So it's a really sort of useful place to do infectious disease research, because we can sort of take questions that you can't ask other places. So we've been working with so basically two groups in Israel. So the first one is with Maccabi Healthcare, which is the second largest HMO in Israel, and covers about 2.5 million people. And like I said, they have sort of amazing health IT systems there, so they know every time you go to the doctor's office, get a test, get your vaccine, they can track that information. They know sort of where you live and who your family members are that are in the system, so you can do some really detailed investigations of people's infection histories. The other group we work with is down in Beersheba in southern Israel at Ben Gurion University and Soroka University Medical Center with Ron Dagan, who's a pediatric infectious disease specialist. So my group at Yale sort of focuses on statistical modeling and mathematical modeling. And so we collaborate with these large healthcare organizations and clinicians who have these types of big databases. So there are a handful of questions that we've been addressing here. And this work really has been going on over the last year or so, basically since last February or so, February 2021. So the first question we were sort of addressing is, how much do the mRNA vaccines influence transmission? So we know that they protect you from infection. We know that from clinical trials. The question is, how much do they sort of impact transmission, and for how long does this effect last? The second question we've been addressing is, what's the benefit of booster doses for preventing infection and hospitalization? And this is specifically looking at the first booster dose. And we can talk also about some recent research about second booster doses. We've also been looking at the benefit of the vaccines for children and sort of how much of an effect that has and for how long. And then finally, we've been interested in this phenomenon that a lot of people are familiar with, that, you know, a lot of other infectious diseases basically went away. So, you know, we haven't had much influenza over the last 2 years. We haven't had a lot of other viruses that cause severe disease in children, like respiratory syncytial virus, RSV, which is probably the biggest cause of hospitalization in babies. So, you know, trying to understand sort of why these things went away and what their reemergence might look like. So the first study that we did just came out in Science, which is a scientific journal, looking at the effect of the Pfizer vaccine, the mRNA vaccine, on transmission within households. So in this picture here, you can see two very frazzled looking parents and their kids playing on the floor. Maybe this looks familiar to some of you. And, you know, we're trying to understand, basically, you know, we know that households are places where a lot of transmission happens. So if one person gets infected in the household, it's much more likely that other people are going to get infected in the household. So we're trying to estimate basically how much does the vaccine, first of all, prevent you from getting infected in the first place, and then if you do get infected, how much sort of further reduction do you get in preventing transmission on to other people in your household? So basically what we found is that initially, so for the first few months after you get your vaccine, you get a huge reduction in your risk of getting infected. So, you know, almost a 90% reduction in your risk of getting infected. And then if you do get infected, you also get a small additional benefit, about another 25% reduction in passing it on to other people. So overall, sort of a more than 90% reduction in sort of preventing transmission within a household. So that was great. Unfortunately, what we found is that after a few months, even though you're still protected against disease, you know, you're much more likely to get infected in the first place. So the protection against infection goes down by quite a bit. And then if you do get infected, there's no additional benefit after a few months. The vaccine doesn't prevent you from sort of passing that infection on to other people. So there is still a benefit of the vaccine after a few months, but it's substantially reduced in terms of infection. It's important here I just want to be clear that we're talking here about the risk of getting infected and not the risk of getting severe disease, because it takes much longer for the risk against severe disease to decrease. So basically, the take-home message is the vaccines prevent infection, and it also, so because it prevents you from getting infected, it prevents you from sort of infecting those around you, and that's benefit is particularly strong in the first few months after you get the vaccine, and then it decreases after that. So subsequently, we did another study trying to look at the effect of the booster dose of the vaccine. So Israel is the first country to roll out the booster dose in August. And so we worked again with the group in at KSM to try to estimate the effect of the booster dose. So what we did here was compare people who got the booster dose to people who had just received 2 doses of the vaccine. And basically what we saw is after a couple of weeks, basically 2 weeks after you get your booster dose, your risk of getting infected was reduced by, again, about 85%. So, what we saw in the other study was that after a few months, your risk of getting infected started to increase again. And then basically the booster brought you back to a level of protection that was seen shortly after you got your initial doses of the vaccine. Importantly, the booster also further reduced hospitalizations in people who had the booster compared to those who didn't have the booster. So the people who hadn't been boosted but had been vaccinated, still had good protection against hospitalization, but it had waned a little bit. It had been reduced a little bit compared to people who were more recently vaccinated. And again, the booster dose sort of increased the coverage, increased the protection again to a level that was seen shortly after the people had gotten their initial doses. So this was a study that we were doing basically in real time as the data were coming out in August and September. This was before the US had recommended the vaccine. And this result was actually one of the sort of pieces of evidence that was cited in the decision to introduce the booster doses in the US. But unfortunately, because we were doing it in real time, we still don't really know how long that benefit lasts. So we know the booster lasts for at least 2 months, because that's sort of how much data we had at the time, but we don't know sort of longer term kind of what the benefits are and how long the benefit lasts. My expectation is that it does drop off again, just as the protection after the initial doses dropped off. So beyond COVID, like I mentioned, all the other infectious diseases went down substantially during the COVID period. So this top plot is what a typical flu season looks like in southern Israel, where you have a handful of viruses that are sort of always around, like rhinovirus. But then in the winter, you have a number of viruses, especially RSV, causes infections in babies and causes hospitalizations in babies, quite a few hospitalizations. So you see this usually picking up around the winter months. If you look at 2020, though, in the winter before COVID hit, again, you can see a lot of RSV that's circulating in the population. Once we get to April 2020, right at the beginning of the pandemic, though, what you see is that basically everything goes away for a short period of time. Even rhinovirus, which is always there, basically goes away. Rhinovirus comes back, and adenovirus, like common cold virus, comes back, but everything else is basically like the influenza A, influenza B, RSV, human metapneumovirus. These are major causes of hospitalization in babies. They just didn't come back in 2020, 2021. And we really didn't see them coming back until last spring or even the summer. So what we saw, this data, these are actually Google data, they're not actually clinical data, but it's actually a pretty good marker for RSV activity in the area. So this is for the Hartford, New Haven combined metropolitan areas. And what we see is that typically in a typical year, which is shown in gray here, we have a peak of RSV in the winter months. And what you can see here is this blue line is what was happening in 2020, 2021. And you see this big peak happening in the summer months. So this is like around, week 26 here is around July. So it's sort of starting the spring and sort of increasing, and it's really stayed high for several months through the summer and into the fall, and even now has sort of been sort of petering along at a sort of reasonably low level. And we've seen this around the world. So we've seen it in Israel. So we've seen RSV and human metapneumovirus come back. And as a result, we've seen pneumonia rates for kids had also, basically cratered down. And they're also coming back now because all these other viruses are starting to come back. And, it's a real problem because basically we had 2 years where we had, kids who were born, since March 2020 had never seen a lot of these viruses, didn't have any immunity built up to them. So there's like this huge pool of kindling that, the infection can just kind of blow through. And that's what we've been seeing in a lot of populations is these really severe or abnormally severe sort of epidemics of some of these other viruses that had been sort of kept at bay for quite a while around the early periods of sort of COVID mitigation measures. So where are we now? So these are data from New York City as of a week or two ago. And I like the New York City data because it breaks down all the data by the vaccinated rates and unvaccinated rates. So these are sort of rates of infection based on vaccine status. So number of cases per 100,000 people who are vaccinated or who are unvaccinated. So we can see citywide is this middle line here. This is the Omicron peak that was sort of going through December, January into even February a little bit. So everything's, basically has gone back down to almost nothing, as we're seeing in the press all the time now. Things are basically back to sort of where they were in early fall or so in New Haven now, I think, or even into the summer, which is great news. But you see this huge gap between the vaccinated populations and the unvaccinated populations. So the rate of infection for the unvaccinated people at the height of Omicron was several times, maybe more than 3 times higher than the rate for unvaccinated people. So even with those issues that I was mentioning where, the protection against infections can wane, the rate of infection in the unvaccinated people is much higher. Of course, part of that could be due to the fact that vaccinated people might be more cautious and taking other precautions, but there's still a pretty wide gap between those populations. We see that also in deaths where, the rate of hospitalizations for unvaccinated people is many times higher than the rate of hospitalizations for people who are vaccinated, even at the height of the Omicron epidemic when there was really a lot of virus circulating. It seemed like everybody I knew, all my neighbors and stuff had it. I'm sure you all knew a lot of people who had it sort of at the height of the epidemic. But if you look at the people who were in the hospital, you were much, much more likely to be in the hospital if you were not vaccinated. And same thing for deaths, where the rate of deaths was much, much higher in the unvaccinated population. There were unfortunately still people who were vaccinated and were hospitalized and died, but the risk is much, much lower overall. And we see this across different age groups and different risk groups. So the take home from this, I think, is that the vaccines continue to work very, very well against severe disease, even with waning and everything like that. The boosters seem to be working. So if we break this down further by booster status, people who are boosted or have even lower rates of death and hospitalization and infection compared to people who hadn't received a booster. Works particularly well against severe disease. It's also important to keep in mind now that increasingly we also have different antiviral medications that are available. So if you do get infected and you're high risk, there are options for treatment which weren't necessarily available or as readily available previously. So if we're thinking about sort of where things are heading over the coming months, I don't know yet what things are going to look like. So they are testing in Israel. My friend Gili has been running a study, trying to look at the effect of a second booster dose. So far, the data doesn't look super convincing that it's necessary. It gives you a moderate increase in immunity compared to what you get from your first booster. But I think we still need more data to say whether it will be needed and effective. But I mean, I would assume that a second booster is probably not going to be recommended before the fall. So at the earliest, the fall population, we'd be expecting that, and I would guess that that'll be targeted towards higher risk individuals rather than everybody. But it's hard to say, and we'll have to see kind of what evidence emerges over the coming months about you know, how persistent or how long the protection from the booster doses persists as we go forward. So just a couple of key points to summarize. So the vaccines work. They prevent infection and transmission, but this decreases over time. And also, I didn't really emphasize this, but it also decreases with different variants. So, you know, when we compared, you know, the original or the alpha variant of COVID with the Delta variant, which was circulating last summer, the protection was lower. And we see again that the protection against Omicron was lower still. So we don't know, you know, what will happen. There are modified vaccines that are being developed, which will hopefully help address that issue. The effect on preventing severe disease and death, you know, is also high at the beginning, declines a little bit over time, but remains pretty high, and it's still a, you know, very effective vaccine, and it provides a large, you know, both individual and public health benefit. And then, you know, the other sort of point is that, you know, a lot of other infectious diseases went away during the pandemic and during last winter, and they've been coming back now with a vengeance. And, you know, we're all, you know, fortunately, we haven't seen a big epidemic of flu yet. That's still sort of been in check. We're all sort of kind of nervously waiting to see what happens with flu if and when it comes back. I mean, it'll come back at some point. We don't know what it's going to look like, but and when that'll happen. But you know, I think, you know, a lot of us expect that the first flu season, when we get flu back, will with a, you know, a serious amount of flu will be severe, but we'll see what happens. Okay, so I'll just finish by putting in a plug here. We're doing a study in New Haven. We've gotten a number of Westville residents who are participating in the study. And the goal of this study is, this is with my colleague Ann Wiley, who you've probably heard about her. She developed the saliva, COVID saliva testing that they're doing on New Haven Green. It's being used around the country. So we're doing a study together to try to understand the potential effects of certain adult vaccines on preventing transmission of bacteria and viruses in households. It's a really easy study to participate in. So we're looking for couples to enroll. So, you know, people who are living together, who are both of which are over 60 years of old, who don't have other members of the household. And it's really easy to participate. Everything's done at home. We sort of ship you the collection kits. Then every 2 weeks, we just ask you to spit into a tube. And then we have a courier that picks it up outside your door. So it's sort of totally contactless, COVID safe type thing. And then we ask for a urine sample the final visit. So there's a total of six visits. And we provide compensation up to $125 per person, so $250 for a couple. It's really easy. We're really looking for people and would like to get more people into the study. So please email us or send me a message afterwards, and it would be great to have you, and tell all your friends as well. It's we're sort of enrolling now over the next couple months, and then hopefully we'll be doing it again sort of next winter. So, all right, let's chat. Let me know who wants to kick off with questions or discussion.
So under reactions, you can use that raise hand symbol for anybody up. Rachel, go ahead.
Hi, Dan. For your scope study, are you looking just for people in New Haven, or could I tell my parents in Middletown who are both over 60 and are empty nesters about this?
Good question. So it has to be, I'd have to check exactly what our catchment area is. We have it defined as Greater New Haven, which Middletown's kind of on the edge of that. So yeah, we can, if you send me their details, or if you want to put them in touch, I'd be happy to put them in touch with their study team.
I will probably be going up to Middletown to see them over the next week because my sister's family is coming into town. But after that, it's complete empty nesting. So I might tell them about this.
Yeah, excellent. Yeah, thank you.
Thanks.
So questions, concerns?
I have a question about people who didn't get vaccinated, who didn't get boosted, but got COVID and still have antibodies after over a year without still having gotten a vaccine.
Yeah, so yeah, natural infection definitely definitely does provide protection. And in some ways, so one of the issues with the mRNA vaccines, or really any of the vaccines that we're getting, is you get injected, right? So that you get a jab in the arm. But where you need protection is up in your nose, the mucus in your nose and your mouth, and that's where you need your immune protection, right? Because that's where the virus is coming into your body. So when you get the jab, you do develop some immunity in your upper respiratory tract, but when you get naturally infected, you develop even potentially stronger immunity at the site, at the place, where you really want protection. So, I wouldn't encourage people to get infected, but if you do get infected, you do have some protection from those natural infections, and it provides protection that's maybe comparable to having the primary series of the vaccine. I don't think it's quite as strong as having the booster, but it does provide some protection.
Thanks.
Betsy.
So I came in late, so I don't know if this was answered. I'm in a couple of groups that now are getting together regularly. There's one person in each group that has not been vaccinated. One wears her mask and separates herself from us. The other did have COVID and she's doing fine. She doesn't always wear a mask. Your thoughts on both of those people when they're with groups?
Yeah, so I mean, as I was mentioning earlier, so the effect of the vaccine on infection and transmission is relatively short-lived. So, I mean, if your concern is about potentially those people getting infected and bringing into the group, I guess I wouldn't be so concerned. I think there's been a lot of discussion about, vaccine mandates and, how that can protect other people. But I mean, what we've seen is that, especially, with the Omicron wave and, as we get further away from the time when people get their initial vaccines, is that, you still do have some protection against infection, but it's not perfect. Like, so, I mean, a vaccinated person and boosted person, probably has, their risk of infection is reduced by, I don't know the number off the top of my head, maybe half or something after some months. So, it's not like, vaccinated people are perfectly protected and, unable to pass it along to other people. So, especially if it's only one or two people in a larger group, I wouldn't be super concerned because, cumulatively, all of you have a risk of infection bringing that to the group, even if you are vaccinated. So I'm not sure that at this stage I would necessarily treat an unvaccinated person differently.
Thank you.
Dan, I'm wondering about variants that are headed in our direction.
Yep. Yeah, there's a lot of very active work going on with that. Yeah, so I mean, there are some variants of Omicron that have been circulating here in Connecticut and have been increasing. I think so far the thought is that, the protection that we got from all the natural immunity from everybody getting exposed to Omicron over the last couple of months is probably going to protect us against this new variant of Omicron as well. I think almost certainly we're going to have new variants cropping up in the future. I mean, there's just so much coronavirus out there in the world. Think about all the people in the world who can potentially get infected, and it's a lot of opportunities for the virus to change. So, viruses mutate all the time and are changing all the time. Whether those variants will be more likely to cause severe disease or less likely to cause severe disease, I don't think we can predict at this point. But there's a lot of, as opposed to earlier on in the pandemic, there's a lot of extremely active work going on to monitor these variants. It's amazing in South Africa, how quickly the variant was detected, And we were able to sort of detect it, sort of the spread around the world. So, I mean, we were basically tracking the emergence of these new variants in real time, which is something that wouldn't have been possible previously. So that has good sides and bad sides. The good news is that, we have sort of good situational awareness of what's coming. The bad side is that there's always new variants coming out. Not all of them are variants that we need to worry about. And, because we are looking really hard and finding a lot of stuff, sometimes it's hard to sift out what's important and what's not important. So, I mean, I expect that we will have some variants that come. The vaccines are continuously being updated. The mRNA vaccines have already been updated to, there are some under development that target the Omicron variant, and I'm sure as new variants arise, they can pretty quickly adapt the vaccines to target new variants. So I'm not losing sleep over it at this point. I think we're in a pretty good place where, everybody has some protection, not everybody, but a lot, a good chunk of the population now has some protection from coronavirus, whether from a vaccine or from getting infected naturally. So we're in a very different place than we were 2 years ago, where we had a totally susceptible population, and people really had to be concerned about an epidemic sweeping through. I think there's potentially now a lot. We're in a much better place. Just individuals' risks are much lower. We still have to worry, I think, about certain high-risk populations. People in nursing homes, especially. I think we need to keep an eye on those populations. But for the general population, people without underlying conditions, I think we're in a pretty good spot.
I think Donna has her hand up.
Yeah, hi. I have a question about masks. I'm not sure if that's your expertise, but they always used to say, and or not always, but they used to say that the primary reason to wear a mask is to protect those around you from your germs. How good is it at protecting you from their germs?
Yeah, so there's this guy Joseph Allen at Harvard. He's a airborne scientist, or I don't know what his official title is, but he studies aerosols and stuff. He's done a lot of nice work summarizing these issues. So I mean, clearly, it depends on the quality of mask you're wearing, but if you have a decent N95 or KN95 mask, it does provide pretty good protection, even if nobody else is wearing a mask. So if you're exposed and you have one of those masks on, it does a pretty good job. If everybody's masked, it reduces your risk even further because there's just less virus in the air. I don't know if I could put a number on sort of how much it reduces your risk to be just masked yourself or having everybody masked. But certainly, the sort of individual, people masking themselves certainly reduces the risk somewhat. Again, not as good as, or not as quite as effective as having everybody masked, but there are a lot of different things that come into play, though, in terms of like the ventilation of the room and all these other factors as well. So, I mean,
So that brings me to part two, because Becky, I don't know if you saw the email Becky just issued a policy and whatnot. So the second question is, if you're high risk and you choose to mask, even though those around you aren't, but you take off your mask for an indoor kiddish, is the fact that you're unmasked for a shorter period of time going to significantly protect you? Like when people say, why are you wearing a mask in services when you're not wearing it during kiddish? That's ridiculous. Or is it ridiculous?
I mean, I think with a lot of these things, there's probably some aspect of like a dose effect. So probably like the longer you're exposed and the higher dose you're exposed, probably increases your risk more. This isn't really my area, but I think there is some sort of thought that reducing the amount of time that you're exposed does have an effect. So, I think, it seems reasonable to unmask for a short amount of time. If that's something of concern, I mean, it probably does reduce your risk compared to being unmasked the whole time. Especially, there are different settings though too. If you're in shul and everybody's singing as opposed to, which might project more stuff in the air, and as opposed to Kiddush where people are sort of more, having sort of one-on-one conversations, it might be a different type of environment as well.
Thank you.
Dan?
Mhm.
I have two issues. One is, are you still doing the wastewater studies and what are they telling you? And the second is what I'm reading about white-tailed deer, which are overwhelmingly in this area.
Yeah, so the sewage tracking is still going on. I'm not involved with it at the moment, but so my colleague Jordan Peschia, who's at the School of Engineering, has been doing that continuously. He actually rolled it out to a number of communities around Connecticut. And the sewage is telling us all good news, fortunately. So the sewage stuff has been amazing, throughout the pandemic. It's in sort of providing early signals. So, I mean, we could see the signal for Omicron, before we could see it in the hospitalization or the case data in the area. And you could also see the decrease in the Omicron wave before in the sewage before you could see it in the infection and hospitalization data. So now it's it's looking good. The local sewage, which is collected in New Haven here, is basically back to a level where it was last summer. So when caseloads were pretty low. So that's been good. In terms of the animal reservoirs, so I mean, we think that SARS-CoV-2 originally, I mean, this is depending on what news channel you watch. I mean, we think that SARS-CoV-2 came from an animal reservoir, probably. We don't know for sure, but we think that it probably originated in some wild animals in China and jumped to humans. And it's common for viruses to jump back and forth between humans and animals. We see this for flu a lot, where you'll see flu I mean, if you go to a farm and you sample pigs at the farm, you'll detect human influenza in the pigs because they get it from the farmers or from other people. And so it's I'd say necessarily unexpected that you see it in the deer population. It doesn't necessarily, I mean, there's always, the thing that people worry about when we see things happening in animals is if, like, for example, the virus is in deers and then it recombines with another virus in the deers and creates a new virus and jumps back to humans that we haven't seen before. I haven't seen any evidence that that's a concern yet. Hopefully it won't be. So I'm not losing sleep over it at this point. Hopefully I'm not proven wrong, but I'd say viruses are often jumping back and forth, and it's not necessarily a reason for concern, but we'll see.
Marcia, go ahead.
Okay, hi. I have questions around your advice for people who are in the 75 to 80 range and who've been very, very careful and cautious and hardly been out at all.
Yeah.
To what changes are really warranted by the differences now, and also in that, can you speak to the risk of long COVID and now I read something about brain changes.
Yeah, really complicated questions. So yeah, my parents, well, they're not quite to the 75 mark, but pretty close, and have been very cautious. My dad caught COVID last winter and got it pretty badly. Yeah, I mean, I think I think a couple of things. One is, I mean, these things are hugely personal in terms of your individual risk tolerance and, yeah, and individual health status as well. I mean, my mom is, has a million underlying conditions and, would probably get very, very sick if she got COVID, even with her vaccines. But, I think even, she's starting to venture out a bit more, as, I think a lot of people are. I think the main driver for risk is how much COVID is there in the community. And right now, it's going way, way down. So that's good. I mean, compared to 2 months ago, it's unbelievable how much it's declined. So, if you were asking me in January whether you should go out, I'd say maybe, try to be safe. Now, I'd say, if you're in a place that's not super crowded, you probably are not at super high risk, especially if you're wearing a mask. Even unmasked, if you go out to dinner or something, if it's not a very crowded place and has decent ventilation, might be okay. But if you're someone who's more cautious, I mean, I think, still keep, there's, as the weather warms up, there's going to be more opportunities for outdoor activities, and those are certainly have been and will continue to be pretty safe, even if there are infections around. But these are really, I think we're just at a stage where these things are just so personal in terms of individual tolerance for risk and stuff that it's really hard to make sort of general recommendations. In terms of the long COVID question, I'd say it's tricky just because there isn't great data on it, but it does seem that the vaccines do seem to reduce your risk of long COVID if you get infected, which is good. Doesn't eliminate it, I don't think, but it certainly reduces it. I mean, long COVID is, very scary. I have a colleague from Scotland who got COVID. She's a clinician and got it in March 2020 and still hasn't recovered from it. So it's, it's a really scary condition, but I think the vaccines do reduce your risk of that. The neurological questions are tricky. I've seen the same studies that you have, I think, that suggest that the virus does have some effects on certain nerve cells, affects, this is probably behind partially the the loss of smell and taste that are reported in some people, and potentially some of the issues around brain fog, stuff like that people report with symptoms. So and those are definitely a concern to me, I think about, but again, depends on your individual tolerance for risk. I think my guess is that what we're going to recognize, and I think we're starting to recognize this, is that a lot of these conditions like long COVID and some of these other issues are not necessarily unique to COVID. There are potentially other viruses and infectious agents that have been triggering these things for years, and I think what we're going to see is that a lot of these unexplained medical illnesses that we've been sort of seeing for years, chronic fatigue and some of these other things that have been unexplained, I think we're going to start to see, some understanding of what's causing that based on all the research that's going on long COVID and some of these other conditions.
Thank you.
That was probably a longer answer than you wanted, but
no answer is longer than I want.
Other questions? Okay. Well, I think you all are welcome to email me questions if you have them, and I'll also if you have any interest in our study, we'd love to have you there as well. So please be in touch.
Dan, thank you. I'll give everyone one more moment in case somebody has a question they want to ask before we let you flee our clutches? I guess not. All right. Next week, there is no schmooze because it's Erev Purim. So we can be maskless at Becky as far as medical masks, but please come in costume for Becky next Wednesday night. Happenings will have the schedule of the children's activities, which will begin earlier. And so please read Happenings for all the details on that. And then, of course, the Megillah reading will be repeated again on Thursday morning, March 17th. Rabbi, any other final announcements or requests or questions?
I don't think so, except this Saturday should be a really, really nice day at Becky. We have a longtime congregant or person who's been in our community, Zane, will be just converted this week. And so he'll be having his Aliyah on Saturday. And there's another baby who's having, well, the baby's not having an Aliyah, but the little kid is having an Aliyah as they're becoming Jewish after a mikvah, or their parents are. It's going to be a really, really nice morning. So I hope to see you there.
So thank you, Dan. Thank you, everyone, for coming.
Oh,
Have
and
a
the
good evening.
Yeah, the Megillah will be streamed as well.
Oh, it will be on Zoom.
On Zoom, thank you.
Good night, everyone.
Good night,
Thanks,
everyone.
Dan.
Thanks. Bye-bye.
Bye.